How many of you dread going to the dentist? And most of the time there is really nothing to fear, but anxiety can ruin a good experience. There is no need to be afraid with all the new ways to help patients relax and actually enjoy a trip to the dentist. You can find some comfort with the folks at Oak Creek Dental. And joining me now from Oak Creek is Dr. John Segnini. Dr. Segnini, nice to have you here.
Thank you very much. Nice to be here.
At Oak Creek, you use something called IV sedation as a way to calm and ease fears. Can you explain that?
Yeah, there's a differentiating types of sedation. Pill sedation has been known for a long time. IV sedation has actually been around longer than that, and that's the type that we employ at our office. My partner, Dr. Tim McDuffie, and myself believe it to be not only more effective, more beneficial for the patient, and certainly safer.
Is the patient all the way out? Can you describe what they will feel, not fear?
You know, our patients, I think, often describe it as they woke up and didn't realize anything. They got there and woke up, and now they're going home.
They have no memory of it.
They have no memory. The medications that we use to induce that calming state has that amnesic effect, which is wonderful both for the possibility of getting them to that ideal health and then not remembering the experience. That gives them a great opportunity to build on more positive experiences in the future, and may even at some point not require any sedation to get ideal health.
You are amazed at the people that you see, you told me, who have not been to the dentist in 10, 20 years.
I would say that our whole team has been amazed at the positive impact we've been able to have on our guests' lives, being that we don't judge people that come in. Our philosophy is come in, let us know where you are, what you want, and then we can help you get there.
You know, you mentioned IV sedation as a way to help folks who have some anxiety and fear, but you also said there's other reasons that some people might want to think of IV sedation, so give me examples of who this is good for.
Absolutely. Certainly our I think, biggest help to our community that we've found is the fearful and anxiety-filled patient. Mm-hmm. We've also seen many others take advantage of this way of pursuing ideal dental care, whether it be someone who has an extremely busy schedule and can't fit maybe several appointments in, but rather would like to do one longer appointment to make it more comfortable with sedation. Mm-hmm. People with gag reflexes, that makes it difficult even to do something as others may view as simple as taking x-rays.
Oh, yeah.
And many patients who have a hard time getting numb or trouble getting numb, this is a very comfortable, easy, low-anxiety way of achieving that goal in addition to whatever work needs to be done.
Now, can folks go on with their regular day once they're done?
Well, typically we have folks we give them medicine ahead of time to make sure that they're coming into us in a low state of anxiety. So they're driven in. We recommend not driving for 24 hours after.
Okay.
The sedation, although they will walk out of our office, know where they are, who they are, what day, what time, but they still will be a little slower than they would be, so certainly not be getting behind the wheel of a car.
What if someone has some health issues that are not related to dental care? Is this good for them too?
That's a big part of what we do. Of course, our main goal is making sure we're getting people to ideal health, but can only do that in the umbrella of ultimate overall health. So if we have someone that has a complicated medical history, our first step is to do a medical consult with their physician. We want to make sure that we're getting them healthy, but doing it in a safe way for them.
And I'm not sure people realize how much the effect of a healthy mouth has on the rest of your body. I mean, good dental care, or gum care included in that, if you have bad, that can really lead to lots of other complications.
Absolutely. Studies are coming out every day linking especially the health of our gum tissue to cardiovascular health. Mm-hmm. And that's one of those tricky things in dentistry, that gum tissue rarely shows symptoms to the patient. Something that needs to be diagnosed. That's where regular checkups are so critical.
Yeah. Okay. Now, you have a special offer for our daytime viewers, and I know you want to share that as well.
Absolutely. For all of your viewers viewing Daytime Columbus, we'd like to offer them free exam and x-rays. Call our office, Oak Creek Dental, 882-5525, and just mention that you saw your show.
And as you say, mention it. One thing is, if you call your office, there's no embarrassment. I mean, the folks on your staff are really good about making people feel comfortable with the fact that, yeah, I can admit the fact that I'm fearful of the dentist, and it's okay.
Absolutely. We pride ourselves and our team on knowing that we're here to help others. We're here to serve the community. We relish the opportunity to do that.
Well, it's nice to have you here, Dr. Segnini, and certainly a service that I know many folks will welcome, especially those people who have a lot of fear and anxiety and haven't seen a dentist in a really long time. So good dental health. Thanks. Nice to have you here.
Thank you very much.